Hi, my name is Kristen Lord, and I am one of the Pediatric Orthopedic Advanced Practice Providers here at Scottish Rite for Children. We see a variety of orthopedic conditions in our clinics, both surgical and non-surgical. I mostly work with children with hip conditions such as hip dysplasia, as well as those undergoing limb lengthening or deformity correction, and primarily work with Dr. David Podeszwa. As I treat many of the infants who are referred to the hospital for DDH, or developmental dysplasia of the hip, I would like to give you some tips that I hope are beneficial to you in your assessment or referral of these patients. First, knowing how to examine these patients in your clinics is vital. We all learn in school about the Barlow and Ortolani maneuvers, but if you've never felt an unstable hip before, it may be challenging to distinguish what you're actually feeling on your examination. When assessing these infants, the most important thing is ensuring that they are fully relaxed. We frequently will do this in our clinics by providing the patient with a pacifier or having the parents feed them while we're examining the hip. By having the patient fully relaxed, you are then able to more accurately determine what their hip range of motion is and if the hip is actually unstable. If there is any question that the hip exam may not be normal, we recommend referring so that we can obtain an ultrasound and more accurately determine whether there is hip dysplasia present. We recommend not only referring patients who have an abnormal hip exam, but also those patients who have risk factors present. These include those patients that are in a breech presentation at time of delivery or for more than a few weeks during the third trimester, as well as those patients with a family history of hip dysplasia. For those patients who have a stable hip exam and risk factors present, we will obtain an ultrasound of their hips when they are between 4 and 6 weeks of age. When there are multiple bursts present, such as in the case of twins or triplets, we recommend screening all the infants, whether they are in breech presentation or not. Finally, we recommend providing all parents with helpful tips for promoting good hip development, even if their baby's hip exam is normal and they have no risk factors present. An infant's hips develop best when they are allowed to keep their legs flexed and abducted like they do naturally at rest. We recommend when swaddling to not wrap the legs tightly in an extended position. Most of the sleep sacks that are available on the market today are designed specifically to promote hip health. Thank you for listening to this brief discussion. I hope you have found these tips to be helpful. Please know that we are here to help you and your patients with any of your orthopedic needs.